Hey guys, last week of February, it is an absolutely beautiful time of year. Hopefully we're filming this outside because it's just about perfect, right? Temperature is great. We're obviously right here along the loop. I encourage you after your adjustment, if it's not raining out there, go for a walk. It's fantastic. Do your rehab, hop on that loop right there and just make that little loop to the bridge, back around the other way and come across the bridge. You get the heart rate up, you get the muscles moving, and you're in that erect position rather than just kind of going back into that hunchy position. So I encourage you, get outside. Now's the time to do so. Not too cold, not too hot, just right. So last week, big shout out, big thank you to everyone who came and participated in our immune function workshop. And so we really talked about how we're seeing so many people suffering with colds and flus and illnesses and multiple bouts of it. You know, it's just that thing that keeps lingering. They have 2 weeks of it, they kind of get better, and then another thing happens, and then another stressful event, they get sick again. And we talked about how you do sick, you don't get sick. And what I mean by that is you make choices, whether it be staying up late at night or procrastinating, waiting until the last minute to try to accomplish something. All of that creates stress, and stress lowers the immune system. And when the immune system is lowered, it doesn't matter how wimpy the bug is out there, you're going to be more likely to succumb to it, right? We give the example of really, if I sneezed over everyone that I got to adjust, which is gross, and I'm not going to do that, but if that were to happen, right, not everybody gets sick. And it's because the immune system is about how you fortify your inside, right, versus just the bug and the germ that's on the outside. And so I encourage you, keep taking care of your inside. Be looking for some tips and some tricks to strengthen your immune system as we go about your day. And with anything in life, you are what you repeatedly do. And so when it comes to a strong immune system, it's not just a wait until I get sick and then I'm going to try to not be sick anymore. Right? It's what can I do on the regular basis, daily, at least weekly, that's going to improve my immune system so that way I'm strong on the inside and I'm more resistant to the stuff that's out there, because the reality is it's always out there and it always will be, right? And so why not strengthen the inside and take some responsibility, and then you know that you have the ability to win. We talk a little bit about how chiropractic is phenomenal for the immune system. Again, by taking stress off that central nervous system, by using those bones and levers and buttons that is your spine, right? By taking some of the stress off those nerves, your body is able to function and heal at a higher capacity. We also talk about, in that immune system workshop, how you have X amount of resources and energy per day. And if you spend a ton working out, and if you are stressed at work and you're having an argument with a loved one at home, or maybe there's some grief going on, right? All of that is weighing you down, and you just don't have enough to give enough energy to your immune system to actually allow it to function properly and resist that invading bacteria and virus and whatever is out there, because it's always going to be out there. And so if you feel that you're going through a stressful time, if you're feeling like you're really run down, that's not the time to really bust it in the gym. That's the time to just maybe take a gentle walk, relax, rest, give your body what it needs, and of course, eliminate all sugar. When you're sick, this is the best time, or when you're feeling those symptoms, best time to get adjusted. I'm not afraid of your germs. In fact, if anyone with a cold or a flu comes in and they're worried about me, if I get sick because of your germs, I'll give you $100, right? I'm so confident it's just not gonna happen, right? Again, we do sick, we don't get sick. And so come in, we'll get you quickly adjusted, we'll get you on your way home so you can rest, and don't worry, we'll clean off the table for the next person. I encourage you to read that article. This week, Monday is yoga. So come join us Monday evening, 6:15 with Patty, and we'll do some mindfulness yoga. Great way to de-stress, declutter, right? It's on a Monday evening, start your week off right. The Vital Shift dinner is going to be on Tuesday. Great opportunity for you to invite your friends, or maybe you yourself have some additional questions. Come bring those questions, get a meal on me, and we can go over how chiropractic works and how to get the best results in this office. And lastly, I'm going to start bringing in some re-exams of the week. And so many of you guys have already gotten to the point where we've usually after the first 12 or 15 visits, we do that first progress evaluation. I just want to share a really cool one that we got just this last week here, where at her very first progress evaluation, we're going to leave all patient names out of this, right? So there's no way that you guys can know who this is. But first of all, she rates at just a month into her care, 80% improvement in both her migraines and her back pain. How cool is that, right? No drugs, no surgery, right? Nothing crazy. On top of that, have you noticed any systems of the body functioning better since those subluxations in your spine have been reduced? And she's noticed that her cycles, the last couple cycles, have been a little bit more regular and a little more normalized. And of course, super excited to see that she's also been able to reduce the amount of ibuprofen that she's been taking for the pain. And so, amazing results so far. I'm super excited to see where she's going to be at in the next month, next time we do our progress evaluation. And again, I can't wait to see where you're going to be at, right? In order to get the best results, it's what you're doing consistently. So are you doing that Denner roll in the back of your neck, or at a bare minimum, those rolls underneath the curve of your lower back and the curve of your neck every night, 20 minutes? Are you doing your spinal exercises? Are you making your visits, your adjustments on a regular basis, right? Consistency is the key. I'll keep encouraging you. Upcoming next, don't have a date set yet. In April, we're going to be talking, or March, I'm sorry, we're going to be talking about our allergy workshop. You know, we're probably just a couple weeks out from the yellow snow being everywhere. We're going to talk about how you can defeat allergies naturally, right? And if you've been that person who, you know, this time of year, you know, March, April, May, you're, you know, always reaching for that medication to help unclog the sinuses and you're itchy, scratchy, yucky all over the place, this is the time. Come get to the workshop, apply these principles, take some action, and you'll see a whole new way of looking at allergy season. So hope this helps. Can't wait to get my hands on you today. Have a wonderful day. Dr. Utash here, Wellness Key Chiropractic. Here's 3 times that you don't want to come and see me. 3 times that you in life that you may not want to go see a chiropractor first. First one is when you fall, you hit your head, and you hit it so hard that you just start vomiting. That would indicate a serious trauma and something that you probably want to go to the ER, get checked out first. Make sure you don't have a brain bleed, if you have a concussion. After you're cleared from, say, the ER or maybe urgent care, then you want to come here and get checked out and to see if that's caused new misalignments in the neck and the relationship to the head and the neck, which can like really lengthen the symptoms that you might experience from that fall. Number 2 is that you're so violently ill that you are puking and going to the bathroom pretty much uncontrollably. And so while we often say that if you're feeling ill or sick or you're under the weather, maybe even have the flu, come in, get your power turned on, release the stress from your body, allow your body to heal at a higher level, a higher rate. That's a great idea. But if you're actively puking, having diarrhea, that may be a time to avoid the visit to the chiropractor. And the last one, pretty evident, self-evident, is if you have a bleeding wound. So let's say you're trimming trees or whatever, and boom, you cut yourself or you jab yourself. That'd be an absolute reason why you'd want to go see the emergency doctor or perhaps urgent care. They could stitch you up, assess the situation, and then again, we can kind of go from there to see if there's more trauma to your actual structure once we know that we're intact altogether. So again, Dr. Utash, Wellness Key Chiropractic, 3 reasons why not to visit the chiropractor first. Hey guys, Dr. Joe Utash, Wellness Key Chiropractic. We recently had a patient who was about to go on vacation and wanted to know, what can I do to make sure I'm minimizing my loss or really keeping my gains, I guess, if you look at it from a positive standpoint. And so we're just going to go around the horn here real quick before we go out and adjust patients. And so that way a lot of people can benefit from the same activity here. So Shoshana, what's one thing that you could do to minimize loss?
Making sure that you're doing your wobble exercises twice a day.
Awesome.
Also
Casey?
doing your homework by doing your home exercises.
Miguel?
And then another thing you can also do is grab a pool noodle or roll up a magazine and put it in your lower spine while you're in the car or on the plane.
Yeah, easy suggestions. You just want to, again, keep that spine in its neutral position, keeping the curves where they're meant to be. So also your spinal molding at home. So either the pool noodles or your dinner roll, pack those and land those at night for 20 minutes every single night. And then really just stay moving, right? Stay upright, remember your posture, and then have a great time, because we'll make up for it when we get back. So whether it's an extra adjustment before you leave or an extra one when you come back, we'll get those gains back, and just enjoy your trip. So I hope this helps. Dr. Joe Utash, Wellness Key Chiropractic. Some tips to stay healthy and strong and minimize losses when you're traveling.
Hey guys, Dr. Utash here, Wellness Key Chiropractic. Oftentimes people get the term cryotherapy confused with chiropractic. Cryotherapy is ice therapy. In fact, the name is a new buzzword, or cryotherapy is kind of the new buzzword because of the new shops, the new clinics, the new places that you can go to where you can get complete body submersion in very low temperatures. This has a lot of health benefits, whether it be decreasing inflammation. When you're using the entire whole body cryotherapy, you can actually, it really can even change some of your body's chemicals. And so something that I've done myself and I do recommend for patients, but in general, cryotherapy just means ice therapy, and it's something that I recommend for any patient who has an acute injury, maybe a strain on, or pull on their back, maybe they hurt their shoulder, and maybe they're lifting weights and they pulled something. Ice therapy is fantastic. In fact, I recommend, and I often give these away to our patients to use on that trouble spot for 15 to 20 minutes on and about an hour off. And do that as needed a couple times throughout the day. So again, chiropractic versus cryotherapy. I hope this helps.